that is particularly a global agenda as enshrined in the SDG goals. And perhaps when we were having a debrief session with Kas Ababu, he reminded me that the UN General Assembly that should be commencing this week has often had the SDG 3.8, which is on UHC, as a standing agenda. And that's how important it is that governments and different counties and countries focus on ensuring that UHC is realized. One of the key tenets when we talk of UHC is to ensure that there's provision of financial risk protection, to ensure that quality health services are available, and to ensure that these services are safe, are effective, and are affordable. And this touches not only on services, but also on the essential medicines and commodities. And so during this period of dealing with the COVID-19 pandemic, it has become more crucial and important to ensure that these financial risk protection mechanisms are at play, to ensure any future pandemics that may come about, they can be mitigated against, and that at the end of the day, Kenyans have access to affordable healthcare services. In this regard, Kenya has begun its journey towards UHC, and we've long shared with you where we are, what we are doing, what programs are in step in terms of reaching and realizing this goal. To begin with, we all have our Linda Mama program, and we continue to remind Kenyans that this program is still under implementation within the country. This program is well resourced. It is a program that ensures that all mothers in the country are able to access skilled delivery services across different facilities, both in the public and private sector. And indeed, this program, the very nature of the design and implementation of this program, it forms a foundation to the UHC agenda. We also have various other insurance schemes that have been subsidized by government. We have the Elderly and People with Severe Disabilities scheme, a scheme that is seeing the coverage of close to 200,000 households in the country, consisting primarily of the elderly and people with severe disability. We do also have the Health Insurance Subsidies for the Poor program, a program that provides financial protection for orphans and vulnerable children, along with the Edu Afya program that provides cover for public secondary school students. And so, with the aim of accelerating progress towards UHC, we are currently working with various state agencies and departments as we put in place reforms in the National Hospital Insurance Fund, which is the main vehicle, which is the main implementing agency when it comes to the attainment of UHC in the country. And so, as we move and as we take lessons and curate lessons, in terms of the pandemic, what we have learned, how UHC links up with COVID-19, we do remember that UHC is an agenda. It's an agenda that is still under implementation and absolutely crucial when it comes to the Big Four agenda, but also the socioeconomic development of the country. In the COVID-19 conference that will be coming up in the next 2 weeks, that will be hosted by the presidency, we shall be able to share with you more information on how these programs have been interlinked and integrated in future pandemic responses in the country. Now, turning on to our COVID-19 statistics, today we have 92 people who have tested positive from a sample size of 2,985 in the last 24 hours. And this brings to total our country caseload to 36,393. These cases are all Kenyans except 4 foreigners, and in terms of gender, we have 64 male and 28 female. The youngest is a 2-year-old child, while the oldest is 75. And in terms of disaggregation by county, Nairobi and Mombasa continue to lead, with Nairobi having 25 cases, Mombasa having 20, Nakuru 8, Garissa 7, Uasin Gishu 6, 4, Kiambu 4, Kakamega 3, Machakos 2, Kajiado 2, Busia 2, Nyeri, Kilifi, and Taita Taveta and Tana River all have 1 case. We have provided you with the disaggregation by sub-county from all the counties that have reported cases today. With regards to our recoveries, we continue to celebrate our home-based care program, which has really gone a long way in ensuring that the health system remains resilient. And today, 165 people have recovered from the disease, whereas 105 were discharged from hospitals and 60 from the home-based care program. We continue to really thank and appreciate and celebrate our healthcare workers for the good work that they are doing. Unfortunately, however, we've lost 3 patients to the disease, bringing our total fatality to 637. And our sincere condolences are extended to the family and friends of those who've lost their loved ones. And in conclusion, today, we would like to appreciate the Ministry of Foreign Affairs for their continued collaboration and championing of the whole of government approach when it comes to dealing with the COVID-19 pandemic. We would also like to express our sincere appreciation to the government of Qatar, who've made donations that will be absolutely crucial in the fight for COVID-19. And these donations, in terms of enumerating what they are, we do have ICU beds that have been provided by Qatar. We have 30 ICU beds. We have ICU ventilators that have humidifiers, those are 3. We have suction machines, 10 of them. We have 10 cardiac monitors. In terms of KN95 masks, we have 6,000 of those. PPE overalls, we have 5,000 of those. Face shields, we have 4,000 of those. Sanitizers, 70%. In terms of 5 liters, we have 200 of those. And then, of course, we have thermometers, infrared thermometers, 500 of those. And internally, as a ministry, we have set up a donations committee represented here by Dr. Kefa. A distribution list has been made, and that will be availed to you. At this juncture, I'd like to introduce Kas Ababu Namwamba to make some few remarks. Karibu, Kas.
Thank you. Thank you, my colleague, Dr. Masi Mwangangi, the Chief Administrative Secretary, Ministry of Health, members of the press, ladies and gentlemen. I am delighted to once again join you here, Daktari, for this very important national exercise. And to just reiterate that at the Ministry of Foreign Affairs, we are firmly committed to continuing to execute our mandate as designated by the National Emergency Committee on Coronavirus and His Excellency the President himself, to support the Ministry of Health in your frontline mandate, your frontline role as the spearhead of the government of the Republic of Kenya in confronting this unprecedented health challenge. We appreciate that the Ministry of Health does acknowledge the role we are playing as a ministry and really confirm to the people of Kenya that this is in line with the all-government framework. It is in line with the all-hands-on-deck approach that has been encouraged by His Excellency the President himself. And in that regard, may it be noted that the Ministry of Foreign Affairs does very strongly, unequivocally, unreservedly appreciate the amazing work that the Ministry of Health is doing in leading all of us in confronting this monster of COVID-19. We are happy that we are kept up to date, and we are not left to any guesswork. And Daktari, allow me really just to stress a couple of things. Number one, the fact that we are not out of the woods yet. And I think it's important for all of us to know that the statistics that are being shared are within context, or within a certain context, the context of sample size, and the context of other dynamics. But it's important that we continue to take very strict personal responsibility to help in this fight. And this applies really to all of us. Secondly, Daktari, let me appreciate the emphasis on UHC in your briefing today. Kenyans may want to know that right now the UN General Assembly 2020 has commenced. And because of this pandemic, it will be a UN General Assembly like no other. This is a landmark year because the UN is celebrating 75 years since its founding. But because of this pandemic, it is going to be largely virtual. Our president himself, a respected voice, a respected presence within the UN family, will be addressing the UN world virtually with the support of all of us for the full duration of the General Assembly. And while this goes on, universal healthcare as a key component of the Sustainable Development Goals will be at the core of the conversation for UNGA 2020. And it is therefore truly significant for Kenya, for Africa, and for the global community that Kenya continues to place universal health care at the core of our health service and at the core of government policy. And of course, this is one of the big four agenda pillars that has the full support of the president himself as a champion of this agenda. And I want to assure you, Daktari, that at the Ministry of Foreign Affairs, in our conversations during this UN General Assembly 2020, and in our interactions with Kenya's partners across the length and breadth of the globe, we will continue to place the agenda of universal health care at the core of our interactions with the rest of the world. Now, today, I come here on behalf of the Minister of Foreign Affairs to present it to you a donation from good friends, brothers and sisters of the state of Qatar. We received this donation on the 14th day of August 2020, a month ago. And I personally, on behalf of the ministry, received this donation at the Ministry of Foreign Affairs from the ambassador of the state of Qatar to Kenya. And as you have already enumerated, it is a consignment that includes a variety of equipment and supplies that will definitely go a long way in contributing to our war chest in this war against coronavirus. And you have correctly said we have 30 ICU beds, we have 3 ICU ventilators with humidifiers, we have 10 suction machines, we have 10 cardiac monitors of 5 parameter level, 6,000 N95 masks, 5,000 PPE overalls, 4,000 face shields, 205-liter alcohol sanitizers, and 200 infrared thermometers. This is equipment which we have no doubt will go a long way in increasing our capacity. And let me emphasize that a large percentage of this equipment and supplies were procured locally. Unlike other supplies, and previously yourself, Daktari, and me and myself received a large consignment from Slovakia the other day. Sure. We have received a consignment from India. We have received a consignment from China. And we have had a lot of our friends across the world coming to support. This particular consignment is special in the sense that it was largely procured locally. And this goes in line with the position taken by His Excellency the President to support local manufacturers and to aid in our larger agenda of manufacturing as a component of the Big Four agenda. And so, while I thank the state of Qatar for making this donation, I also further thank them for trusting the Kenyan producer, the Kenyan manufacturer, in procuring this equipment and these supplies locally. Daktari, let me also take this opportunity to thank our Qatari friends for extending support to Kenyan nationals living in Qatar at the height of this pandemic. And the government of Qatar was able, through the Qatar charity, to provide food donations to Kenyans in distress in Qatar. And up to 2,000 food packages were received by our embassy in Qatar and distributed to Kenyan nationals there. The state of Qatar further worked very closely with us to fly back to Kenya our distressed Kenyans who were stranded in various parts of Qatar. And so we stand here really to celebrate real, tangible friendship and ties that bind between the Republic of Kenya and the state of Qatar. We thank you, and we also extend this appreciation to all our other friends across the world that have continued to stand with us during these challenging times. Once again, Daktari, asante sana.
Thank you.
Na tuko tayari kuendelea kuwapatia full support.
Thank you. Thank you.
Na nisisitize point moja ya kwamba sisi huwa hatupokei tu.
Naam.
Tunapokea, lakini sisi pia mahali tunahitajika kusaidia. Kenya has also been ready to help.
Fantastic.
Thank you very much.
Thank you. Thank you so much, Kasababu Namwamba. I think at this point we'll have some Q&A.
Good afternoon. My name is Purity Museo from KBC. My first question is in regard to before Kenya opened its borders to the international community, we were reporting few cases of imports of COVID-19. Maybe since August 1st, an update on whether we have any increasing number of imports of COVID-19 or not. And then number two, when you compare Kenya, or let's say Africa, with other countries, 7 months on, and still you're saying over about more than 70% of the cases are asymptomatic. Again, Cast this week you said that the kind of virus that we are dealing with is no different from other countries. Maybe you can explain why Africa is experiencing asymptomatic kind of the virus. And lastly is on the vaccine development. China has already started some human trial of its vaccine. Maybe is Kenya taking part in this? If not, do any efforts in also developing our very own? Thank you.
Good afternoon. My name is Robert Muirore Kangara from Kameme TV. My concern is about the COVID fund investigations. We understand that the 21 days given by the president are over. What do Kenyans expect? Thank you.
Beldin Waliaula from KTN. I wanted to ask about, we've said that from last week we've been recording less admissions in hospitals, less congestion in hospitals from COVID-19, but we've discovered that this week we have more people who are discharged from hospitals compared to home-based care. Why? And also, yesterday we recorded 10 deaths. The number is too high compared to now that hospitals are not congested, we have enough oxygen. Why are we losing more people still up to now?
I'm Haimba from Ebro TV. Maybe to Waziri Namwamba, maybe I would like to get maybe your comment in regard to Tanzania lifting the ban of the flights, Kenya and Tanzania. Maybe what exactly does it signify? And then maybe what exactly is the value of today's donation? And earlier on it was actually hinted that KEMSA is one of the parastatals that has been tasked of the storage of such facilities. Is it the same KEMSA that is storing the same facilities, keeping in mind that the same KEMSA is having a stock worth 6.2 billion Kenya shilling stock that is now lacking market?
Thank you. Thank you all for your questions. I'll start with the answers, and then I'll invite Ababu Namwamba to also add in some more information. Beldina wants to find out why do we have, a peculiar situation where we have fewer admissions, and yet today we've reported that most of our discharges are from hospitals as compared to the home-based care program, and why are we losing more people? Beldina, this is an important question, and yesterday Dr. Kuria was able to explain that when people are dying, for example, when we reported 10 cases yesterday, it was interesting to note that it was a new occasion where most of the cases were actually people who have no other known conditions, and that only 3 of them had comorbid conditions. What becomes interesting to note is that when you're studying the progression of disease and when you're studying outcomes from a disease, you do not, you're a human being who has many factors within yourselves. When we say someone has died from COVID-19, yes, that is what may be written in the death certificate, but remember, people may have other conditions, other statuses in terms of their body's immunological strength to fight COVID that contribute to that death. So it's not a simple matter of we lost 10 people yesterday and therefore yesterday was a bad day. These 10 people were in hospital for a varied number of days. Some people were there for 3 days, others had been there for a few weeks. And in that period, what we call the length of stay in a hospital unit, many things can happen in terms of your body trying to fight the condition and to be able to either survive it or succumb to it. And so every time we report, and what we are getting to is every time we report 2 people have passed on or 10 people have passed on, that measure in of itself alone should not be used as an indicator of how severe COVID is in the country. It is not enough. You need many other measures that you compound together to get a clear picture of how severe or how COVID is in terms of status within the country. But DG will be able to expound more on this issue. With regards to Purity's question, I appreciate, and really I appreciate the anxieties of, is really COVID different in Kenya compared to other countries? I think this is the question that is recurring every day. Is our strain different? And really we emphasize our COVID-19, when you look at its genetic makeup, it is very similar to other COVID-19 viruses across the world. So we are dealing with the same COVID-19. What, however, is peculiar is that there have been different evolutions of this disease in different countries. For one, Africa and Kenya have reported more asymptomatic cases. And the good thing is that studies are underway to find out, is there a peculiarity in Africa or in Kenya that offers some form of protection when it comes to COVID-19? And one of the most likely hypotheses, and we were discussing just this today with Kas Ababu, is that Africa and Kenya is filled with a younger population. We are young as a continent. If you look at our population pyramid, it is absolutely different from that in the Western world. And because we are young, it means then there's that protective effect of being young, having a younger population, and therefore not seeing the high mortalities that we were able to see earlier in the disease. That has been posed as one of the explanations. Scientists are trying to find out what else could explain this, and like I've told you, a lot of work is underway to determine how that looks like. You know, what does it mean to have an African who has a comorbid condition and has gotten COVID? Is that different to Italians? Is that different to Americans? And there's a lot of studies underway in that regard, but we must maintain and we must remind you, our COVID, ni ile ile, it is the same COVID that was there in Italy, that is there in China, same COVID. We have a good question here on importation of cases from Purity, questioning if we now have been able to define any imported cases after operating the airspaces. We do have a team, an integrated team that works with the KCAA and the airport authorities and MFA to look at our numbers of incoming passengers and outgoing passengers. What is important right now, perhaps, is not to really deal with imported cases, but to realize we have community transmission in the country. And if, on average, I think I saw in the last month about 14,000 entrants into the country, if 14,000 people came into a population of 40 million who already have community transmitted COVID-19, it means that effect is highly diluted for that to be a cause of concern. And this is the premise through which globally, countries agreed it was time to start opening up our borders. And so DG again will expound on this section. KEMSA issue, two-pronged question regarding the investigations that are underway in the COVID-19 fund. I'm well aware that the teams who are dealing with this issue are well appraised of their timelines, and I'm aware they are preparing their reports. And these reports shall then be forwarded to the necessary people for their consumption, and then, of course, shared with the public. And so give time for this process to be undertaken. You'll be able to get the full reports and all the sort of granular issues that need to be answered. We still family, and I need to emphasize this, we're still family. invest and believe that KEMSA, by the very nature of it being a body that leverages on the economies of scale, is adequate to be able to undertake the distribution of these commodities. Remember, KEMSA, if you think of it like an octopus, has networks to more than 6,000 health facilities in this country. In other words, a commodity stored in the KEMSA warehouse is able to get to almost 6,000 facilities in this country. That network has been invested in over years, more than 10 years in KEMSA, and that investment cannot be disregarded. And so, yes, that remains the agency. And I'm well aware, again, within KEMSA now, there's great transparency in mechanisms that will ensure these commodities are able to get to the health facilities. And KEFA here can give you assurances of the distribution list, and you can follow him and confirm that these things will get to the facilities that they need to get into. I think at this point I'll have Kasa Babu come in and comment on his question, and then we'll have DG really talk about this virus. Is it really different? And what more are we learning about this virus in Kenya?
Thank you, Daktari Mwani Haemba threw a couple of questions at me. The first one is about the resumption of flights or the opening of the airspace between Nairobi and Dar es Salaam. And just to tell you and tell Kenyans that Kenya's foreign policy is about constructive engagement with all, is about good neighborliness, is about sharing prosperity and being there for one another. And it is in that spirit that we consider ourselves to be a good neighbor to all. And we consider Tanzania to be a friendly, brotherly, sisterly country with whom we definitely share a fantastic relationship. And we can assure you that we will continue to nurture and cultivate this relationship. We want to focus on the factors that make us stronger together. And we have such many factors between ourselves and the United Republic of Tanzania. And so we are happy that we can engage, we can interact through the airspaces, through our roads. And our assurance is that Kenya will continue to pursue that policy, that line of good neighborliness and constructive engagement. Now, regarding the consignment and where it is headed, I can assure you that we have full confidence in the capacity of government to not only handle this pandemic, and I think those of you who even watch global analysis, global news, you will know that Kenya has been highly rated amongst countries of the world in the manner in which the government of the Republic of Kenya has handled the COVID-19 pandemic. And we are proud because as Chinua Achebe says of the little lizard that jumped from the high Iroko tree, we must always be ready to also acknowledge what we have done right. And we have done it right in the manner in which Daktari, your team at MOH, has definitely done Kenya proud. And when we talk about KEMSA, my position, and this is a personal position, is that you must always draw a line between institutional capacity and personal or individual responsibility. And so if there are issues raised in respect of any particular individual issue that are being properly investigated by the requisite agencies, that must not be commingled with the capacity of the institution and the responsibility of an institution which is in fact a statutory institution. And so yes, we have absolutely no doubt that as we hand these consignments, and we have received many of them, and will continue to receive more of them, we'll hand them to the Ministry of Health with the full confidence that they'll be put to good use. And Haemba, these consignments or these supplies can never be too much. We cannot say now we have 6.2 billion worth of supplies. Now we should not enhance our capacity. We must have as much as we can manage to put together, because really we are dealing with a scenario that no one can accurately predict how long it's going to be with us. And so yes, we'll continue to seek support, we'll continue to build our capacity, and we'll continue to play, as Minister of Foreign Affairs, supporting role to the frontline ministry, which is the Ministry of Health.
Thank you, Kas Ababu. Now we have DG.
Thank you, CS, Dr. Mercy, Kas Ababu Namamba of Foreign Affairs. There was a question regarding imported cases of COVID-19. The Ministry of Health, working together with the Ministry of Transport and affiliated sagas under the Ministry of Transport, that is the Kenya Airports Authority, the Kenya Civil Aviation Authority, and the respective airlines, developed protocols to ensure that we open our airspace, because we had to balance between lives and livelihoods. And because of these protocols that we developed jointly and implemented appropriately, including public health social measures, mandatory screening at the ports of entry, and insistence on a COVID negative certificate before arrival in Kenya, and also guided by the WHO risk profiling of travelers. We have not seen any change in number of imported cases coming into the country. Of course, we also have a very stringent follow-up through our web-based platform. And because of this, there's no significant change before lifting the travel restriction and now when you have opened our airspace. And it is usually very easy when you are dealing with a public health problem to have people enter through a very, very restricted point of entry where you have control, instead of people coming through multiple points. So for us, people coming through Jomo Kenyatta International Airport or Mombasa, Moi International Airport, Mombasa, or Kisumu or Eldoret, makes it very, very easy for us to be able to focus on them and ensure that we do the appropriate follow-up. A number of cases asymptomatic versus asymptomatic, actually for our cases is 93% of our cases, or the 36,000 plus, have been asymptomatic, and only 7% exhibit any symptoms. And as Dr. Mwangangi stated, we postulate that this is because of our young population. Remember, like in Kenya, more than 65% of our population is less than 35 years old. The younger you are, the less likely that you are going to have a comorbidity like hypertension and diabetes. Compare this to Europe and the Americas, where you have a more elderly population, more people more than 60 years who are at a greater risk of getting a severe form of the disease, and of course with a concomitant comorbid conditions including hypertension, diabetes, and other cardiovascular diseases. This could have explained the reason as to why we have more people who have a milder form of the disease, and also we have a lower mortality. If you look at our case fatality ratio, it stands at 1.7 against the global average of 3.2. And it has been consistent at that figure for the past 3 or 4 months. And of course, going forward, as we get more and more cases of the COVID, our clinicians, the nurses, the doctors, our lab scientists, of course, they gain experience managing these cases, and therefore case management has also equally improved. Vaccine development, on Monday I told you that there are more than 180 candidate vaccines on trial. And of these, 5 are already in phase 2 and phase 3 trials, where we are now testing them in human beings, like the Oxford, I'm sure you know about the Oxford AstraZeneca vaccine, which was stopped a few days ago, but again, the trials have resumed. And working very, very closely with Oxford, because we have partnered with them even before this COVID-19 pandemic. We will be part of this vaccine trial with our team in Cambridge, Liffey. Remember, we are also one of the first people to have done the genetic sequencing of this virus when it was reported through our team in Cambridge. It is important that we are part of this vaccine development, one, to enable us to generate data for policy decision. Number 2 is also to ensure that when we eventually get a vaccine that is safe and works, then that vaccine, we can be certain that it works for our population. And number 3, if you are part of this vaccine development, of course, when the vaccine is eventually available, we are at the top end of the priority in terms of availability of the vaccine. So for those 3 reasons, we believe strongly that as members of the global scientific community, we should participate in this to be able to inform science going forward. In terms of the genetic sequence of the COVID-19 virus, it has remained the same. And as I've told you, it was even sequenced in our lab in Cambridge, Kilifi. We have noted a few cases of mutation, but not in the African continent. So the kind of virus that we are dealing with is the same virus that is now hitting India very hard, had hit Brazil very hard, and US and the other parts of the world. So the virus has remained the same. In terms of the vaccine, again, it is important to know that we are also part of the COVAX, COVID Vaccine Facility, an initiative by Gavi, the Global Vaccine Alliance, and WHO, where the global community is supposed to raise about $37 billion towards the process of availing a vaccine for COVID, including the logistics of how this vaccine will be supplied to the rest of the world if it becomes available. And we have signed that agreement with COVAX through Gavi and WHO through our mission in Geneva, and we'll continue to follow very, very keenly the process of this vaccine development. Deaths, yes, deaths, of course. I've told you our case fatality ratio is 1.7%, which compares very favorably with a global average of 3.2. But reasons why people sometimes die, like the numbers we reported yesterday, is one, of course, self-medication, because the symptoms of COVID are not specific. Somebody would simply take over-the-counter medication thinking that you are dealing with a normal or ordinary flu, yet you could be dealing with a very deadly virus, the COVID-19. Another reason, of course, is late referral, especially when people seek care at the community level. And of course, there's something that we mentioned previously, where you could be having a very, very serious illness, and you have what we call silent hypoxemia, where your lungs are affected by this virus, but on average you feel fairly well. So by the time you report when the disease has actually affected a number of your organs, and therefore salvaging you becomes a difficult process. Thank you.
Thank you. There's one more comment from Kasababu Namwamba that I think is important. Karibu Kas.
Daktari, just to emphasize on this question of the vaccine, is that from where we are seated at the Ministry of Foreign Affairs, we are encouraging the same global solidarity that we have seen in responding to this pandemic from the moment it broke out and was declared as a pandemic by WHO. That we want to see all countries of the world, really, those that have already taken steps to help the world to develop this vaccine, come together and collaborate. And so we will continue to encourage the collaboration of all the countries that are part of this, and also, of course, ensure that Kenya is part of this, because the development of a vaccine is not merely a competition. It's not a negative competition. It is a positive race against an existential threat. And so we are encouraging the same solidarity, really. Thank you.
Thank you, Kas. Now we can receive the items.